Hello and welcome to Mini Medicos. Today we will talk about intrauterine growth retardation. Intrauterine growth retardation. So what is intrauterine growth retardation? It is diagnosed when weight of the intrauterine fetus is either less than 10th percentile of the weight appropriate for that gestational age, or the weight of the fetus is less than 2 standard deviation below the weight appropriate for that gestational age. So when the weight of baby is less than 10th percentile or less than 2 standard deviation below the weight appropriate for that gestational age, we will diagnose that baby is intrauterine growth retarded. So what are the causes of intrauterine growth retardation? So there are maternal causes, there are placental causes, and there are fetal causes. So talking about maternal causes of intrauterine growth retardation, they are pregnancy induced hypertension, if the mother is suffering from pregnancy induced hypertension, or placental insufficiency, chronic renal disease, or heart disease, some kind of connective tissue disorder, or some infections, or mother having diabetes mellitus with vasculopathy. Generally, in the mother of diabetes mellitus, baby is large, that is known as macrosomia. But if along with diabetes mellitus, vasculopathy is also present, this compromise the fetal blood supply. So in this case, IUGR will be present, not macrosomia. So what are the placental causes of IUGR? First one is placental insufficiency. Placenta is not providing enough blood to the fetus for its proper growth, or abnormal placentation, or placental calcification. All these are the causes of placental causes of IUGR. So what are the fetal causes? Some kind of genetic disease or infections, if present, can lead to intrauterine growth retardation. Now we will talk about types of intrauterine growth retardation. Types of intrauterine growth retardation. So it depends upon when the insult or the cause for IUGR occur. If it occur in early pregnancy, number of cells, because in early pregnancy fetal cells are dividing and increasing in number. So if fetus is affected early in the pregnancy, number of cells will decrease, and this is known as type 1 IUGR. Type 1 IUGR is one where the fetus is infected early in the pregnancy. So what is type 2? If the insult occur in the late pregnancy, only size of cell decreases, but not the number of cell. Number of cells are normal. So this type of IUGR is known as type 2 IUGR. This is type 2 IUGR. So in type 1 IUGR, what are the changes that we are going to see in the fetus? So all the USG parameters are affected, like abdominal circumference will decrease, head circumference will decrease, biparietal diameter will decrease, femur length will decrease, fetal weight will decrease. So all the parameters are decreasing symmetrically. That's why type 1 IUGR is also known as symmetric intrauterine growth retardation. So what are these? Abdominal circumference, head circumference, BPD. All these are the USG parameters, ultrasound USG parameters to assess the growth of fetus. To assess the growth of fetus, we measure femur length, BPD, head circumference, abdominal circumference to know whether the fetus is growing properly or not. But in case of type 2 IUGR, as we already studied, insult is occurring late in the fetal life. So all the USG parameters are not affected symmetrically. Only abdominal circumference decreases, weight of the baby decreases, but other parameters like BPD, head circumference and femur length are normal. That's why this type of IUGR or type 2 IUGR, also known as asymmetric intrauterine growth retardation. Type 2 is asymmetric intrauterine growth retardation. So brain is spared. As we said, BPD or head circumference is normal. So what does it mean? Brain is spared. Blood supply to the brain is spared, known as brain sparing effect. Ponderal index PI is normal, while in type 2 ponderal index PI decreases. So what is PI? PI is weight of baby in grams divided by height of baby in centimeter cube multiplied by 100. This gives the ponderal index. Height is estimated by femur length. It is actually femur length in centimeter cube multiplied by 100. So in type 1, ponderal index is normal. In type 2, ponderal index decreases because type 1 is symmetric. In type 1, weight is decreasing. Also the femur length is decreasing. That's why ponderal index is normal. But what we studied in type 2, weight of the baby decreases but femur length is normal. That's why ponderal index will decrease in type 2 intrauterine growth retardation. Now diagnosis of IUGR. First you identify the maternal risk factors. Maternal risk factor by taking history or examining the patient. You should assess whether patient is suffering from PIH or chronic renal disease or heart disease or some infections or diabetes mellitus with vasculopathy. So there are USG parameters, which are, we already studied, head circumference, abdominal circumference, biparietal diameter, femur length. Also there are Doppler parameters like umbilical artery Doppler. It is best way to diagnose IUGR. So what you will see in umbilical Doppler? In normal patient, you're going to see this kind of reading. Okay, so this is the systolic flow, and this is diastolic flow. This is the normal patient. This is seen in normal patient. While in IUGR, you will see systolic flow is normal, but diastolic flow is decreasing. Systolic, diastolic. Diastolic flow is decreasing. This is the patient of IUGR. Other changes are later on. You will see absent diastolic flow, and then finally reverse diastolic flow. Here diastolic flow is reversed in reverse direction. During diastole, blood is actually coming out of the baby's body. So this is very dangerous, and you have to do immediate delivery. If flow reversal is present, immediate delivery is done irrespective of the gestational age of the baby. If diastolic flow is absent, what management protocol is followed? You have to keep the pregnancy up to 37 weeks. Close monitoring is done. But in case of flow reversal, irrespective of the gestational age, you have to do the delivery. So this was a short topic over IUGR. Thanks for watching this video. Like and subscribe Mini Medicos.